Hello, dear colleagues and MRCP aspirants. Today I'm going to highlight how to approach a case which is coming in the scenarios like patient is having fatigue or tiredness. So, after introduction, we have to ask the question to make our pathway, which way the patient is going, and what could be the possible diagnosis in this patient. So, we have to ask the patient, what do you feel? Which part of the day you are more tired? So there are three possibilities. Patient will tell you, I'm feeling tiredness at the end of the day, or patient may say, I'm feeling tiredness at the start of the day in the morning time, or the patient will tell you, I'm feeling tiredness all over the day. So these are the three different answers in three different patients you will get. So how to reach the diagnosis? If the patient is saying I am having tiredness at the end of the day, so most likely the patient is indicating that he is having myasthenia gravis. So you have to ask the questions related to myasthenia gravis. Do you have drooping of the eyelids? Do you have double vision? Do you have difficulty in swallowing, especially in the evening time, all these symptoms? Do you have difficulty in breathing? Do you have difficulty in combing hairs? If yes, then the patient is giving you diagnosis that he is having myasthenia gravis. In the second patient, if the patient is telling, no, I am having tiredness at the start of the day or early morning, I feel tired. So then this is the case indicating that he is having or she is having obstructive sleep apnea. So how to ask the question related to obstructive sleep apnea? So there are a few questions that I'm highlighting here. So do you feel you are having morning headache in the morning? So yes. The second thing, did your partner or your wife told that you are snoring while sleeping? Yes. Then do you stop breathing sometime, or you have pauses while you are sleeping in your breathing? Yes. And then the other question could be like, do you have daytime sleepiness? Do you have unfresh sleep and you have to take naps while you are sitting at your workplace or while you are watching TV, or whenever you are having any pause or any you do not have anything to do, you fall asleep very easily? If yes, so these are the answers indicating that the patient is having obstructive sleep apnea. So we should proceed for further investigations and the complication that could be associated with obstructive sleep apnea. Yeah. Okay. Then the third scenario could be the patient is telling, I am having tiredness all over the day. So here there are different possibilities, and I am giving you the mnemonic here. Powder, POWDAR, powder. So P stands for psychiatric illness. Do you have any psychiatric illness like chronic fatigue syndrome, fibromyalgia, low moods, anxiety? So these patients, if they have the psychiatric features, patient can have tiredness all over the day. Then P for pregnancy. Also in pregnancy, middle and the late stages, the woman can have the tiredness all over the day. Okay. Then O is simple obesity. Obese patient can have the tiredness all over the day. Okay. Then W is indicating the weight changes. There are certain conditions in which the patient is having weight gain, and there are certain conditions where the patient is having weight loss. In both of these conditions, the patient can have tiredness all over the day. So to make the differential diagnosis or to reach the diagnosis of weight gain, we have to ask certain questions. Do you have weight gain? Yes, I'm having weight gain. How much? Over the period of how much time? Okay. Then there are different causes for weight gain. Patient can have Cushing syndrome, patient can have hypothyroidism, patient can have acromegaly, patient can have metabolic syndrome, patient can have polycystic ovarian syndrome, patient can have type 1, type 2 diabetes mellitus. So these are the causes of weight gain leading to tiredness all over the day. If the patient is telling, no, I am having the weight loss, so you will ask it is intentional or unintentional and how much weight loss you have and over how much period of time. Then we have to ask the patient the question related to condition where the patient is having weight loss, like the patient with hyperthyroidism or thyrotoxicosis, patient with pheochromocytoma, patient with malabsorption, and patient with type 1 diabetes mellitus. So we have to ask the questions related to weight loss. Okay, then in these type of patients that we discussed till now, they will have normal appetite. Thyrotoxicosis patient may be having normal or increased appetite. Pheochromocytoma patient will be having normal appetite. Malabsorption and type 1 diabetes mellitus will be having normal appetite. But there are some situations where there is weight loss but appetite also low. So what are those conditions? It could be Addison's disease, it could be chronic disease like chronic infections, connective tissue disorders, cancers. So these are the conditions where there will be weight loss and loss of appetite also together. Okay, and then D for drugs. So we have finished till now P, we have finished the O, we have finished W. So the next mnemonic is D. D stands for drugs. Some drugs can lead to tiredness all over the day. Medicines include antihistamine, diazepam, hypertensive medication, statins, and antidepressant. So these are the medicines that can lead to tiredness all over the day. Then A is for anemia. So anemic patient can have tiredness all over the day. So we have to ask the question related to anemia. And the last one is R, restless leg syndrome. Do you have urge to move your legs every now and then? Yes, then the patient will be having tiredness because of restless leg syndrome. So that's it from our discussion today. So I highlighted how to approach a case with fatigue or tiredness in our exams. And this approach is very important. This is systemic approach that will hint you, that will guide you towards your diagnosis. So making the diagnosis or the possible differential diagnosis is of prime importance in your PACES exam. Thank you so much. Be attached with PACES Pulse Academy and share our video clips, like them, and join our WhatsApp group also. And to attend our upcoming courses, you have to contact PACES Preparation Pulse Academy. Thank you so much again.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.